Please help me change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare, and us paving the way into a new vanguard of medicine.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
And it's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers.
Oh, hey everyone, happy May. It is May Nurses Month. Happy Nurses Month to all of you.
And happy Mother's Day to all the moms out
Happy
there.
Mother's Day to the moms.
Yep.
So we have a good CNHC program today. As always, I like to just start with the network. If you found us, this is the monthly mastermind. You can always click right here. For anybody that's lost, just click Zoom meeting. Sometimes there's a pop-up window block, and you can just hit allow and it'll show. But all of our events coming up are in here, and then all of the programs here, and then the CNHC Mastermind and Toolkit area is all here. And I might pop back to this later, but the Toolkit has everything that you could possibly need once you finish the programs to jump in, study this, and create your own coaching practice. So we are working off of the 2025 Cannabis Nurse Health Coach Program. I can always come back and talk about any questions or any needs or issues in the program, but this is the most comprehensive program that I can imagine creating. And so it's only going to keep getting updated and bigger and better all the time. But first, we are going to talk about my Nurses Week celebration. This is a funny little AI picture that Sherry made of me as a nurse. And, so it's all good. So let's, we're going to be talking a lot today about this. Cannabis is a Schedule 3. It's a celebration and a challenge, which is what we always talk about. What's a celebration? We're celebrating Nurses Week and Mothers, and then we're celebrating a challenge that is, now what in Schedule 3? Because there's a whole lot of development still to come. But essentially, on April 23rd, the Department of Justice placed FDA-approved marijuana products and state-issued licensed products into Schedule 3. This is going to open up research, which is probably the biggest thing that we could imagine in changing this. So, cannabis now has medical benefits as admitted by the Department of Health and Human Services, the White House, and now the DOJ and the DEA. So that is part one. And then part two is all the research that will be forthcoming. People can research medicines that are true to what people are using, as opposed to just the dirt weed from Mississippi, that NIDA controlled stuff that they were using before for research. So we're really excited to see, Schedule 1 fall for all the medical reasons so that we can start conducting the research that's needed to prove the efficacy and the improvement in outcomes for cannabis, and that the addiction and abuse rates are not as worrisome as they think. So that's my celebration and challenge. It's the now what. And we'll be talking about that. One of the things that I like to say is that rescheduling is a process, not an event. And if we keep seeing it as such, then you'll understand that this is just going to continue to unfold. It's not just an event, it's a process. And so we're just, at the tip of the iceberg as far as what this is going to mean. But really, especially in medical states like Florida and Pennsylvania, there is no adult use. So all of the products and the vendors that are creating them, the producers, manufacturers, the dispensaries, all of them are now dealing with Schedule 3 substances because there is no adult use. And that's going to be an interesting thing, in the states that have both, like all of us right now, Massachusetts, Arizona, and California, they have adult use and they have medical. But the producers are going to start to shift more of their assets and focus on the medical lines so that they could get the tax breaks. Because part of what happens here is that 280E goes away for them. And so they'll be able to deduct business expenses and only pay taxes on their net profits as opposed to the gross revenue, which is what they were doing before. So there's the taxation. It's also going to open up people to be able to use cannabis that are, federal employees, people that are maybe not in sensitive areas like transportation or direct healthcare. Those are probably still going to struggle, but housing, people used to be discriminated against if they were a medical cannabis patient. That's not going to happen as much anymore. And then also gun rights. Some of that should be changing because it's no longer a Schedule 1. So all kinds of good things can happen as we go forward. And then finally, June 26th or 29th, 2026, we will have a rescheduling administrative hearing restarted for the adult use side of this industry. And so once that starts, then we'll be able to say what's going to happen with the adult use side of the industry, and how are we going to treat those products and those people, because it's the cannabis users on both sides. But for right now, the medical side of things, the patients, the brands, the producers, the dispensaries are all going to see things in a different light, but it's going to take a while to unfold. So any questions or discussion on that, or anybody else want to talk about a celebration or a challenge that is on your heart? Do you? No? Okay. Cam, you're off mute. You want to share a celebration or a challenge?
Yeah. I mean, I'm really excited, obviously, about the rescheduling. My main kind of win in this is just the increase in accessibility, and I can hope. I know that CMS is starting to do trials and things like that. So that's promising, and my hope is, it makes it accessible, financially to all people that can benefit, so that basically everybody, that can then benefit from the medication. Accessibility for BIPOC community, accessibility for so many people. And like you said, federal workers, and, just really super excited about on just how much it's going to increase accessibility. And I like the way that you put it. It's a process. It's not an event, because that is for sure. We who knows how long we're looking at, but it's going to be, you know, little changes here and there. And I'm just trying to stay positive with like any change is a move, toward the right direction.
Yeah, just for relativity, I was part of the implementation of the Affordable Care Act, and that passed on March 23rd, 2010. And nothing even began until 6 months later, September 23rd, 2010. But then really things started to just unfold over the years. And
Yes.
I think a lot of that is going to happen with cannabis. But you mentioned the access, and that is going to improve across the board, and there will be a heck of a lot less discrimination. As far as the affordability, I'm waiting to see the pipeline from the biotech, biopharma companies that are making cannabinoid formulations, because now those will be able to get into, phase two through phase three testing for actual FDA approval. And then those medicines will be covered under insurance. As far as the botanical versions being covered under insurance, that is still unfolding. And of course, hemp being in ACOs and using CBD in Medicare, that again is still in development. We have no certainty on how that's going to work, other than the Realm of Caring and CW Botanicals is partnering with CMS and the government to be the initiators of that project. But we also have to figure out what's happening with hemp CBD full spectrum, at the end of the year when, November 12th arrives. Is the sky going to fall, or are we going to be okay? I know that something's going to happen where they're going to keep full spectrum hemp and they're going to move all of the intoxicating formulas over into dispensaries. That's what should have happened in the first place. And hopefully rescheduling will make it easier for that to happen, because cannabis will be more approachable for more of the country, as opposed to red state, blue state, urban, rural. That's going to help access as well. So, Rhiannon, you came off mute. What else?
Yeah, I was just gonna say that I'm hopeful. I don't know when or how this will happen, but right now, working with a lot of the assisted livings that I do, there's some that are allowing, they'll all allow their residents to take it if they can administer it themselves. But if their medications need to be administered, right now there's some assisted livings that will do that, and there's some that will not. And it's, I think it seems to be that there are a lot more that are not allowing it currently. So I'm hoping that this will change, and I'm going to start reapproaching, especially some of those that I work closely with and have clients in. And I've, from the beginning, have been talking about the benefits of them, changing these rules and policies to give their residents the right to choose what medication they want. So I'm going to use this opportunity to kind of, re-engage the conversation about that.
100%. And it starts with awareness and education, right? So the residents aren't even going to know that this is on the table as something that they should ask for. But when we're out there, informing the public, speaking at senior centers, speaking at, assisted living, speaking at, any community centers, looking for any kind of holistic events that are going on, and making sure that you go there so that you can, interact with those people and say, hey, I can give a talk on this, 30 minutes to explain the basics of the endocannabinoid system, the products, how this works as medicine, and a note on the legalities. And then you can get asked to go speak places, because then, it takes a village to do this. We're all needing to be mouthy advocates at this point.
Yeah.
That'll help us to be able to get out there.
Definitely. And I've done a lot of those in the last year or two, since I've been doing this. And this is, I think, a great opportunity to kind of offer that again to a lot of the communities that I've done it in. So yeah, I definitely want to do that.
Yeah.
I do have a celebration to share, which we forgot to mention. So IGI Global is publishing a cannabis nursing textbook this year. And Elizabeth and I have written 3 chapters, and all 3 chapters of ours have been approved.
And they'll be published.
And
Nice.
it's going to be published. So we're really, really excited. My chapter is on spirituality as the root of cannabis care. So really looking at the spiritual principles, bringing in philosopher, bringing in a lot of different, Gene Watson's theory on human caring, and then building out a model of what it would look like when you are dealing with patients, the spirituality first clinical model. So when we're working with patients, how we meet them where they're at and how we fold in the biopsychosocial spiritual aspects of healing. So that's my chapter. And then Elizabeth wrote 2 chapters, and I'll let you share.
So the first one is medical cannabis curriculum and what belongs in nursing schools and colleges and universities. And it literally gives them everything that they need to teach, along with a lesson plan in 10 weeks on how to do it. And then the other one is the Cannabis Nurse Experience, or some version of that, where we talk about the nursing as an advocate, a liaison. I was going to get to entrepreneur because it's the liaison in the hospital. And that's what I tell people, don't go try to be a cannabis nurse. There's not a whole lot of money in it yet. But what you do need to do is add cannabis into what you're already doing. So the practical applications of cannabis nursing in a health plan, in a hospital, in a medical group, whatever, and then the entrepreneurial aspects of it, and how you can add this if you're a holistic health coach or something like that. This is what we're all doing, trying to have that holistic integrative lens, and cannabinoids are, sometimes seen as the cherry on top, but they should really be the foundational structure, just along with rest, connection, nutrition, movement. Cannabinoids should be there to modulate the ECS, which then modulates everything else. So
yeah, really excited that we're going to be published in that.
Yeah.
And then we just submitted our microdosing chapter as well for a different publication for IGI Global, and looking at microdosing as a harm reduction tool, because nurses are the first group of, generally, it doesn't matter if you're a psychiatric nurse or a home health nurse or a visiting nurse or any type of nurse. Patients disclose to nurses what they're using generally first. And so this chapter that I wrote was about a harm reduction approach and how nursing is the point of contact for really working with patients that are microdosing and being able to utilize endocannabinoid system care if patients do disclose that they are microdosing and what that looks like. So that was a really fun chapter to write. We wrote that.
And just reflecting on Nurses Week, nurses, like if you're in the hospital, we're the most trusted profession, but we're also probably the most trusted professional. If I was a patient, maybe I'm a little hesitant to say something to my physician. I wouldn't be, because I'm me. But like other people, right? They don't tell their doctor because they're afraid to be judged. But the nurse comes by, it's, hey, what do you think about this? Because I didn't really tell the doctor, but I'm a little worried about, and I have this CBD in my bag that I'm taking, how does that work with these other things that they just started me on? That nurse is going to be that first person that is going to hear that.
Yeah. And then one other celebration is that, and we haven't actually published this in a publication, but Elizabeth and I wrote our first white paper on Bloom Hemp CBD on the advanced focus tincture. So it's a really great article. We'll drop that into the network for you all to take a peek at.
I have it in my blog link section.
Yep. So the white paper goes into ask the question of, wow, we had an amazing formulation that did amazing things in clinically and showing results of how patients were able to use this. But can you imagine if we added in nurse coaching, how the results might have been a little bit better? So we had great results using the formulation, but this did not include nurse coaching. And so adding in the layer of what nurse coaching would look like with one of these real world evidence studies and how the outcomes might have been a little bit different, a little bit better, then what we, we had great outcomes, but what if we did add in that layer of nurse coaching and how that could be a little bit different?
Yep. So we'll get to that in a minute. So as always, I always ask if there's any questions on the CNHC program, the content, any case studies or business issues that anybody has to discuss. Put your hand up if you want to talk about anything within the program or the toolkit or anything. Otherwise, we'll move on. Okay. And then I always like to just give a reminder that in the beginning of the year, and some of you have missed a couple episodes here, but if you go back and you look at the video training in the CNHC threads in the portal there, you'll see that I had the business blueprint in January, mastering your money in February, magnetic marketing in March, and then customer connections and partnerships in April. Go back and watch, the first few minutes of the last few months, because we just finished last month, but they're all fresh, and it's good ideas for building that business. And really making sure that you understand the nuts and bolts of doing this.
And so for people that are new to the Cannabis Nurse Health Coach Mastermind group, we do have 2 years worth of recordings of every month. So you would be able to access those videos in the space to see what we've actually talked about in those groups.
Yep. So this is the moment that is the most fun. So we're going to go through these 2 questions, and I think I'll go off screen share, and we'll have each of you, just answer these 2 questions. One, what does the rescheduling of cannabis mean to you, and what are your hopes for your business, for your community, for you personally, for your patients, for your family, etc., or for the industry, etc. And then how will you use the content and mentoring from the CNHC program in your work and your life? So how is this applicable to what you've done? So what does rescheduling mean to you? What are your hopes? And then how will you use the content and mentoring from CNHC in your work and life? So I'll just say first, what it means to me is, it's hope. I love this picture, with the flag behind the cannabis, and imagine, these trichomes coming to life and healing the millions and millions of Americans. I've been a nurse for 39 years at this point, come June. And, I've seen how ineffective conventional care is for chronic conditions. And that's what I'm most excited about, because the endocannabinoid system, it wanes, just like, we start producing less estrogen and vitamin D and things like that as we age. Our endocannabinoid system doesn't work as well when we age. And, so when we're able to supplement and restore health to that, we can start to heal some of the other things that may not just be aging. And so I'm really excited about that from a healthcare system standpoint and from a personal standpoint, that it's going to be easier to access and use this sacred plant. And of course, I'm happy about the content here in CNHC, because I'm hoping that it will be more utilized and people will find out about us. In fact, we have the domain cannabisnursecertificate.com and board certified cannabis nurse. And both of those are what I'd like to start marketing more, because CNHC needs to get out there. More people need to add this so that they understand how to do this as medicine. So do you want to answer these 2 questions, or?
Sure. So what does cannabis, the rescheduling of cannabis mean to me? So it means to me now that I can actually say that, gosh, this has been recognized as a medicine, right? I'm not doing anything illegal anymore. I'm, my I's are dotted, my T's are crossed. And, I can truly say that, cannabis brings that hope and inspiration for growth and healing that so many different patients are looking for. Hope that they can have a better day. Hope that they don't have to, take another pharmaceutical or have another procedure when they can use something that's going to correct cell signaling. And when they have that hope, they're inspired. And when they're inspired, they're in spirit and they're open to learning. And once they're in spirit and they're open to learning, this is where we teach them how to utilize other tools that support and nourish the endocannabinoid system. And once they're in hope, inspiration, the growth is an action word. They have to do something. So it's not just about taking cannabis or hemp CBD products, but it's about actually taking care of the endocannabinoid system, eating differently, sleeping, paying attention to connection and rest and movement and meditation and earthing and grounding and all of those woo-woo tools that I so believe in, right? And then healing. And healing, as we know, isn't the absence of illness or disease. It's truly about doing the best you can with what you have at any given moment. And so I'm really hopeful that cannabis-free scheduling will bring that hope and inspiration for growth and healing to more patients across the country. And then how I plan on using CNHC is I plan on helping you to develop more mini modules. So this is what we're doing now. So we're taking some of the cannabis courses that Elizabeth has created and we're redoing them and the mini modules that exist.
Cannabis and dementia, cannabis and Parkinson's and MS, autoimmune conditions, mental health, chronic pain, autism and epilepsy. Did I say mental health? There's more.
Autoimmune, Parkinson's.
And holistic as well, and functional medicine.
So using what Elizabeth created to help her actually work on these other mini educational modules and updating all of those this year. So that's what I'm doing.
Yeah, and then on that note, we also got the name domain cannabiscliffnotes.com. So that's what all of these targeted learning are going to be. And I know that people can Google things, or they can go on, ChatGPT and say, how do I take cannabis for dementia? But this is better, right? It's what is the condition? How do we normally treat that? What is the pathophysiology and etiology and prevalence and incidence? Then what is some of the research about cannabis and that condition? And then what would be a good way to have starting protocols, and then
the case studies
and for each route of administration for that condition and how you're going to use it, and then case studies so that people can understand how this plays in real life. So we're going to be relaunching all of those, and that is really exciting. So that's how we're going to be using CNHC stuff. Who else wants to talk about what rescheduling means to you and how you're going to use this content?
I can go. For me, it's all about the older population that I work with, and just knowing how many traditional medications these patients typically are on. For me, it's more that I hope that clinicians will see this as more of a viable option to start with first versus all these other medications, because I feel like if you can start with cannabis first, it's just going to be so much more beneficial for quality of life for these patients, and that's my biggest hope for this. So, and as far as the program for me, I think I'm. This is my third year that I've been involved, and I think I got certified about 3 years ago with you all, and. For me, it's just been a wonderful resource to have access to and to be able to get studies. And I know I can reach out to either one of you, and you're always so responsive. And I feel like I have this just expertise behind whatever I'm doing. And I express that to my clients, the families that I work with, and other clinicians. And I feel like that gives me so much confidence in doing what I do. So thank you.
Thank you. Yeah, please keep sharing the program so that this can grow.
Yeah, I definitely will. Somebody else on my team is going to sign up in May. So
nice.
Yeah.
We'll take good care of them.
Good.
Okay, Cam, how about you? What does rescheduling mean to you, and how are you going to utilize the CNHC?
I think rescheduling means so many different components or things to me. The first that comes up is just freedom. Freedom as a patient to use the medication and not feel the culture induced shame that we've been battling for years. And recognizing that this is a, nature given plant. It grows in the ground around the corner if you let it. And, just accessibility to all people as well. I think that's going to be super important. And with the accessibility, I think, we're going to discover more and more wonderful things about this plant. The scientific discovery is just a small fraction, I think, is what we know compared to what we are about to discover. And so just opening that door to, more studies and validating this as a medication, I think is amazing. Also, I have, you know, um, nurses in my current position who, um, weren't even aware that Epidiolex is a form of cannabis, as an example. I'm hoping that cannabis becomes as common as Tylenol, as ibuprofen, as acetaminophen, like all the things, and Rhiannon made a good point. I'm hoping that it becomes first tier parts of treatment rather than the last ditch effort, which Epidiolex is beautiful and it helps a lot of people. But even right now, it's still kind of thought of as, the Hail Mary, if you will, when really we know otherwise. So it's going to be freedom, accessibility. I think that we're going to do a lot in reducing discrimination and um you know uh unlawfully incarcerated people for
Yeah.
using a medication. I mean, the targeted community of BIPOC community and all those things. It's just going to mean so much freedom for many different people in many different ways. So I'm super excited. I think this is an absolute game changer. As far as how I'll use content, definitely. If I want accurate info, this is the place that I go. So there's that. If I want evidence-based accurate info, this is the place that I go also. And as Rhiannon spoke of, when you realize that there's companies like you guys behind you, it gives you that little boost of confidence to stand in the gap for so many people and speak something that is, controversial in some circles, and the answer to controversy or misunderstanding is always going to be education. And to get to be like, I have goosebumps, like to get to be the person that stands in that and is pivotal in changing the narrative on cannabis is amazing. And I wouldn't be able to do that if I didn't have the resources that are available from CNHC.
Oh, awesome. Well, thank you so much. And you mentioned, the stigma. Think about 100 years of prohibition, right?
Yeah.
Like, it's 2026. So, back in the 20s of the 1920s, you started to have some states, state by state, saying that they're not going to allow cannabis. And it was very demonized and it was very racially motivated.
Yes.
People were worried about losing jobs. People were losing, they basically thought that cannabis was going to make you insane, as far as reefer madness and that whole campaigns. It came out of there, and of course, Ainslinger, DEA agent number one, the creator of all of this, and then of course, Richard Nixon putting it in the Controlled Substance Act, in 1970, after prohibition started in 1937, formally with the Marijuana Tax Act, where they were taxing 100+% of the value of cannabis, so nobody could afford to use it in the middle of a depression. So something that might have cost you $5 as for a cannabis extract that you could buy at your pharmacy was going to start to be $500. And so it just, became completely unusable. And that, also was the pharmaceutical industrial complex, and all of that began to develop. And now we've got a lot of work to do. So education, awareness, speaking in front of the communities, your healthcare associations, assisted living, any kind of nursing organizations, they all need to know because they're going to advocate for the patients. Because a lot of times, unless the pharmaceutical companies are bringing it to doctors, it's not going to be the doctors. It's going to be the nurses, the hospice workers. They're going to be saying, "Hey, let's use cannabis." And of course, it is a last-ditch effort, a last resort, and we need to make it a treatment of first inclination. Especially when you've got things that are a good CBD and combination gummies, that or soft gels, easy to introduce into the medication administration, in facilities. But most of the time we're talking about home care, right? Don't think about this just for facilities. Gosh, cannabis is something that is being used by millions and millions. 50 million Americans used cannabis in some form last year, and probably only 0.5% are in facilities of any kind. So, people are using this where they are, and cannabis can keep people stronger, help with cognition, help with mobility, help with, all of the above, appetite and eating and sleeping, and
protecting your immune system.
eat, sleep, relax, forget, protect, right? It goes back to Vincent DiMarzo and how useful cannabinoids are for all of the above. So this is going to keep seniors home. It's going to keep people, that are able to get cancer therapies in the game and continuing to take them, because it's going to help mitigate the side effects. But 99% of this is going to happen in the home. So make sure that you're just advocating for this and educating and enlightening. Think about the Enlightenment era. We're in that again now with respect to cannabis, and it's going to take some time. But and then Cam, you were talking earlier about tribes, and
Yes.
having some approach. I think one of the Native American tribes are looking for cannabis nurses. And because that tees up, that tees up the conversation of this will be something that you will get a job with at some point in the future.
Yeah, absolutely. They're looking for two, like you said, two cannabis nurses, one more for like the advocacy of things and navigating regulations and tribal regulations. But then the other one is really, meeting patients where they're at and offering, taking a full assessment and offering the best treatment options for them, while also respecting their right to accessibility of cannabis for other, other spiritual reasons and cultural reasons and as well, So yeah, they recently got a grant, and the Navajo Nation is looking, or Navajo tribe, excuse me, is looking for those two nurses. And I just think this is just the beginning of, what's available. And now that I also think like dispensary wise, obviously they're going to do some shifting and things like that, and how they kind of lay out the products and things like that. But um one thing I was thinking of is they're going to need more of us, because it's now declared a medication, and that's going to change the way that things are presented to the customer or the population. And they need that knowledge, and if it's not us in the room with them, it's educating them through sessions, webinars, and things like that on how to pick the best, most useful medicine, for their patients, as opposed to, I want the high THC.
Right.
Which, speaking of which, my father-in-law is a Vietnam veteran, and so he comes from the hardcore 60s, and hardcore is, he marched the areas of Vietnam, with rolled joints, no doubt, everywhere that he could possibly, have. And so he's never really stopped, but he's in heart failure right now, and he's dealing with fluid, volume overload, of course, which can, cause some anxiety. Well, I just a point of education. Yesterday, I was talking to him and he said, "Yeah, I really like those high THC ones, the ones that he gets from the dispensary and stuff." And I was like, "Well, that, I mean, and he further explained what his symptoms are. And while he is volume overloaded, I also think he's having a sense of anxiety." And I was like, I used that moment to educate him, like, this potentially could be anxiety. And so meditation can help with that. Deep breathing can help with that, more of a holistic approach, but also educate him like, hey, 28% THC sounds fun until it's not,
Right.
Um, so that just moments like that, and just the freedom to be able to speak to those things in safety, not fearing for your job or whatever, I think is just it's a complete game changer.
Yeah, so that's like with your dad, but imagine you're on a unit and somebody's that's treating cancer, whatever, and they're disclosing that they're using cannabinoids. Some are smoking flower, but some are just buying the gummies, and they're all THC. You need to use that place for education and say, well, at least consider a 1-to-1, right? So have CBD, have THC, which they can still get at the same dispensary, or in a tincture or gummies, or lozenges or capsules. Sometimes you'll see those, or flour. Sometimes you can find that, and or vapes. And you can also take the dispensary products and pair that with some good hemp CBD at the same time, so that you could still use those dispensary products, or if somebody's growing and making brownies for you, but you add, a tincture that is all CBD on the other side of things, so that they take the tincture and then a little while later they use the THC, so that you're helping with that allosteric modulation of, CBD at that CB1 receptor. So A, they don't get so high, B, they don't have the side effects, and C, the THC works better with CBD on board as the entourage effect.
Yep.
Is that
Yeah.
what you're
That's
gonna say?
exactly what I was going to say.
Okay.
I also think it's going to be largely beneficial for our nursing students and new grads, because what if they're in a clinical situation where they have no knowledge of the endocannabinoid system?
Yeah.
What if they come from a cultural background where it is shamed and the use of it is shamed, and they, relay that negative stance to a patient who otherwise is benefiting? Like, they need to know how to navigate that. And it's not a matter of if we educate them, it's a matter of at which point do we educate them, and the sooner the better, because it just becomes a part of their whole medical approach to care for a patient. So I think that's going to be huge too. And how long have we had the oh gosh, I'm going to
I
mess up
already
the
know.
name.
NCSBN
Yes,
guidelines.
thank you. How
We've
long
had
have we had
2018.
those?
2018, this has been
Yeah.
around. And this is,
Yeah, almost
yes,
10
the
years.
64-page document, the Journal of Nursing Regulation, all nurses, all nurse practitioners, nursing students must have 6 essential areas of knowledge when it comes to cannabis as medicine. Nurses, this is your time to learn, to be educated, because you will be the game changer for some patients someday.
Yeah, and back to the dispensary. So we talk about, the practical applications on the unit or with your father or anybody, but in a dispensary, having that nurse behind the counter that is going to be able to be pulled in, and anybody that is mentioning anything in that store, is going to be able to be pulled aside and say, talk to Cam, talk to Rhiannon, talk to Sherry, right? Because these ladies know how this works and how to give you the best of the treatment. So maximizing the benefits, minimizing the harms, and any kind of negativity. and giving you a best chance, and then talking about the interactions, talking about the different routes, the different cannabinoids, the different stacking options of using short acting and long acting, a little bit of inhalation with a vape, a 1-to-1 vape, and then that 1-to-1 tincture and the topicals, and adding more CBD for people that are coming in saying they're fuzzy, they're feeling more anxious. Any of these things that we know are excessive THC, the nausea, right? I'm getting stomach cramps. Well, gosh, let's put CHS on the table, right? And see what's going on with you. And so there's in the store, but then also go back to module 3, unit 8 in the tool, and not the toolkit, in the program, where I'm talking about how to be in the community. So as far as that dispensary, it doesn't have to be a person in the dispensary, but doing the webinars. So finding dispensaries and saying, I will do a webcast for you, for your patients. So once a month or quarterly or something, have a cannabis nurse talk, the cannabis nurse news. You can work with that and have something every quarter, so that here's the updates from the clinical world, from some of the legal updates and what that might mean for you. That you're going to be incredibly resourceful to a dispensary system, to a healthcare system, to all of the above. So I'm super excited about all of that too. And the Navajo Nation, that's not just in Arizona. There's other states that have that tribe. So if they're doing it in Arizona, some of the other people in neighboring states might want to, put their ears up and see how they might be able to get involved. And it's not just them. I mean, think about all of the other tribes that, can do this, and that. And then on the nursing students, everybody needs to learn the basics of the ECS, how this works as a medicine, and the different routes and cannabinoids and interactions and conditions and basic protocols that we'll have in the program. But it starts from learning this at the beginning of nursing school. I have a colleague who got into this because a nurse was dismissed just shy of graduation because she came up positive. I guess they drug tested the students, and they kicked her out of nursing school. And she had to start over and graduate from a different nursing school. And, that should never, ever happen, ever, where somebody is kicked out because they're positive for cannabis. And so I hope and pray that changes tomorrow.
Yeah.
So
For sure. Okay.
Okay.
Back to the slide.
Yeah, let me go back on share, and we will go back to here. Let's see. Okay. So we were here, and let's see if I can get this to come back on. I'm a little bit, did I freeze?
No, I can see your mouse
Okay.
moving.
My slides are just frozen. Sometimes they do that. Okay. So this is where we were. Thank you both for talking about this. It's really cool that we could have that dialogue, and maybe we'll have snippets of this each CNHC where we get some other opinions. So in the meantime, we've got a few minutes left. I let's see, it's 5:14. Let's just anything on this page, jump out at you we've already had a couple of stories on how you're teaching your patient is your father, how you're teaching providers. Rhiannon sharing, the program with a colleague who's going to enroll next month. Simulation of a cannabis education session. I'm always doing all the talking. I was wondering if anybody wanted to say, here's a care plan that I put together. Here's how I educated somebody, or a workshop that I'm planning to give, or any kind of role playing. And then, any time that you've had to research a condition and add cannabinoids. In fact, just the other day, Rhiannon emailed me and said, do you have anything on smoking cessation? And it's like, gosh, CBD is so useful in that situation, because not only is it going to be reducing anxiety, reducing inflammation, but it also helps with withdrawal. It helps with some of the symptoms, and the addictive thinking's, some of, even think about CB1 receptors in the brain that, CBD is helping inhibit FOS, so you've got more anandamide, quieting some of those signals saying, I got to smoke. So many different ways. And so, anybody want to talk about any of this?
I mean, I do know my kind of one of my passion areas is mental health, just because I've personally struggled with it and have a lot of family members that have as well. And I know one of my family members experienced severe difficulty when trying to wean off of an antidepressant.
Mm-hmm.
Just the breakthrough tears, anxiety, shortness of breath, the physical symptoms, whether it be brain zapping or, just all the different things. And CBD has really helped to kind of mitigate some of those symptoms in dose, every time it's time to reduce dose. So and that was also an opportunity for education too, because they have a commercial driver's license and they were like, oh, I can't use cannabis, I'll fail a test. And I said, well, now the probabilities are always going to be there with CBD that has the entourage effect intended when you combine it with the small amount of THC. And so I don't want to ever promise it won't happen, but it was a good point of education for me. It's not like the equivalent of lighting up a joint at a party. It's much different, and it's a much more controlled um, approach to things. And, so we kind of overcame that barrier through conversation as well. So really
Cool.
a good win-win.
Yeah, and on that CBD note, full spectrum for everybody listening, can trigger a positive urine drug screen. However, that trace amount, 0.3% is the legal limit today. That might be changing, but it doesn't seem like it's a lot, to use episodically if you have it once in a while. But that's not how CBD is meant to be taken. CBD is meant to be taken on a daily basis so that it's helping to be the anti-inflammatory, anti-anxiety, helping to normalize all of the other receptor cell signaling throughout the body. And, if you take CBD that's full spectrum on a daily basis, it accumulates. And when that happens, or somebody's stressed and they're burning fat, it's going to go into the urine and be excreted.
Well, and if you think about the reason why it gets stored in the fat is it's actually
lipophilic.
It's lipophilic, but it's protective for the body. So when you get stressed and you pop a fat cell for energy, it releases some of the byproducts to initiate a cellular response. You're releasing some of the
But that's not a natural physiological condition because endocannabinoids are made on demand.
Of course.
So they're not stored like other neurotransmitters are stored.
Right. But in other words, for example,
the phytocannabinoids would be stored.
That's what I meant.
Yeah.
The phytocannabinoids that are stored in the fat cells get popped and it's used as energy. Right. So typical example of that is someone that is using, cannabinoids daily and they work out, right? And they get that. I know sometimes when I go to the gym afterwards, I might feel a little bit more elevated than normal. And I'm like, I didn't take anything. Why is that? Well, it's because I am re-engaging my receptors because I did pop some of those fat cells, and I'm getting
THC is circulating.
It's circulating in my system, and
it's bumping up with the extra anandamide that is produced with cardiovascular exercise.
Exactly.
Yep. But the other thing, you could always teach them about broad spectrum and isolate, and working with a good reputable company. So, like at Bloom Hemp, we have CBD isolate. In the shop, as well as broad spectrum. With tests, you could look up the COAs and see that the delta 9 THC is 0. Same thing with delta 8 THC. Anything that's going to give the THC. And so there are some products that are safe. And again, going back to rescheduling, more and more, we're hoping that that's not going to be an issue.
Yeah.
So, okay, another couple of things. Any questions on care plans and toolkit resources? I always like to pull this up and make sure. I know that both of you have been in the toolkit, you've been using it, we've had discussions. I won't go into this anymore, but if anybody out there is listening to the replay, let us know if you have any questions with respect to the care plans. There are all kinds of examples along with a blank one that you could use. And when are you going to use a care plan? When you do some patient coaching and you want to communicate to them. Here's what you told me about your medical condition, the diagnosis, some of the pharmaceuticals that you're taking. Well, here's some of the research that would substantiate how cannabinoids can support this condition. And then a little bit about interactions that you might want to steer clear of, or spacing the pharmaceuticals from the cannabinoids to give us a little bit of a buffer to make sure that the liver enzymes are processing, especially in seniors, where people are on a lot of different pharmaceuticals and their processing of the supplements and the pharmaceuticals don't go as quickly as they did when they were young. So all of that kind of thing. And then, we always include a little bit of the holistic side of things. So how to enhance the diet, anti-inflammatory foods, holistic modalities, getting moving again, how motion is the lotion, and even just a short walk or a little bit of fitness, chair yoga, anything can be good for you.
And how to use nutraceuticals to enhance endocannabinoid tone, making sure if patients aren't eating the right amount of foods, getting enough essential fatty acids, because essential fatty acids is what help creates the endocannabinoids in our body upon demand.
So it's all there in the care plans, and we'll be adding more over the years. But we've got a host of them in right now. And always remember to communicate this liability and disclosure type of information. This is still educational in nature. We are not anybody's providers, because that's really only a physician-patient relationship, a provider, NP, etc. We're the educators, the coaches, the advocates, and the ones that are going to be that game changer option. So here I have a couple of things. We have the May blog that you might want to read. This one is May with nurses and mothers. And I always like to put this in the chat just in case anybody wants to look at it. Our blogs are really good. And of course, you can always get ideas and communicate some of this to your communities or use it somewhat in your marketing. Sherry makes these beautiful ads. And by the way, we have Nurse 50 active all month for Nurses Month. And so if you know somebody that wants to enroll, tell them the time is now because they're going to get the best deal. The other thing, I have this open already. This is the white paper that Sherry and I wrote last week. We met with a company. I'm not necessarily going to say who right now, but it's a company that is big in medical cannabis on a national footprint. And they asked us if we had any white papers. And we're like, well, no, but we can make one.
We can make one.
Yeah. And so this was on the Bloom Advanced Focus Tincture study that we did. And do you, I don't know if you have any graphics on that study because you can see how long this is. I mean, it's a true white paper, but if we go back over to Bloom Hemp right here, we'll just show you the study real quick. This is the focused tincture, and it's a 6:1:1 CBD, CBG, THCV, along with lion's mane, yerba mate, and reishi. And the study showed that we had 52% greater productivity. It's more than 2.2 hours per day. 40% had increased focus. 72% had lower stress. 52% had lower appetite. And 24% lost weight. 78% said it passed their expectation. And 70% had increased mood. And then we did a podcast with Cody Peterson from the Kenigma, and he's a pediatric pharmacist and a science geek. Make sure that you always follow Cody Peterson on LinkedIn. He's a super good guy. But yeah, his LinkedIn is amazing. But anyway, so this goes into more of the study, and then you can get the full study right here. Yeah, on right here. Read the full study, and you can see how we use validated questionnaires and how this was all set up. So anyway, there's lots of research that went into this, but what our hypothesis was that we think that if you added, since this was a telehealth company doing nationwide telehealth for cannabis, if you added nurse coaching, the outcomes would have been even better than that result that we just showed you. So think about, how we could help make modifications to other things if we're in the mix, if we're talking to the patients and making sure that they're able to use the products to their best interest.
Because at the time that we did the study, we weren't allowed to have any contact or communication with any of the people that were
No,
taking.
we just had to send them the medicine at no cost because they participated in a study, and they were women from 30 to 70. We wanted people that were having, PMS and menstrual issues as well as menopause. And anybody that's in perimenopause or menopause itself, that's really the audience. They're losing, they're having some brain fog, cognitive issues. Their memory is not as sharp as it is. They're not sleeping because of their hormone changes. They might be having hot flashes and vasomotor issues. They're anxious. Appetite's changing, sex is changing, a lot is changing. And so we wanted to be able to work on that as well as cognition, because, and focus. There's a lot of women that need to be focused. We're all hard drivers nowadays. You're trying to make a living, nobody's a leave it to beaver wife anymore, hardly. So, we got to be busy and productive. So anyway, that was that. So it's really cool. I think I put that in there. So, and then of course, check out the Green Nurse Substack, Sherry's syndication. I'll just copy this and put it in. I'm so proud. She writes, Ask the Green Nurse all the time. That didn't copy. Hold on a second.
Yeah, the Substack.
Hold on. Let me just hit copy link and put that in, because she's working on getting syndicated in more places. The Kenigma is carrying all of Sherry's work, but then also we're hopefully getting in some more places, because I want Ask the Green Nurse to be just as useful as Dear Abby, and all of that in the times when people had housewives. But anyway, and then my Substack is Wine, Women, and Weed. That is my second book, my memoir that I just published. And so if you want an autographed copy, you could just, I guess, yeah, I could send it to you. Normally, people just order it on my website, which is elizabethmack.com, which is also kind of fun to have. And then share the free programs, the free ABCs of CBD and the free Intro to Cannabis course with your networks and communities. And then, of course, share your Bloom Hemp affiliate link as much as you can. I think both of you have them. So, this is where you can earn while you learn, and, share your link. People are going to shop. You make 20% of all sales, and we will help you with, what should be recommended. We do that all the time. We have several nurses that'll message Sherry and say, what do you think about this patient? And then she'll give them ideas, and then they'll help them buy that. So this is something that just came out today. This is a really cool little Bloom Hemp dosing for seniors.
And I'm writing a blog on this.
Yeah, you talk about
currently.
this.
Yeah, so this is kind of fun. So we, I did a lot of research, spent a lot of time kind of thinking about if, we were to implement something for seniors in assisted living, what would it look like? And how would we do it in an effective way? And what would be a protocol to get them started? And so, we need to look at, seniors that haven't had any experience with cannabinoids, you really want to start off with things that they can actually take that is very similar to what they might be already taking. So we started with all soft gels. So looking at breakfast being a broad spectrum soft gel, it's 25 milligrams of CBD with the minor cannabinoids, no THC, so taking one of those. And then at lunchtime, adding in an immunity soft gel. Again, this would be 50 milligrams of total cannabinoids, equal parts 12.5 of CBD, 12.5 of CBDA, 12.5 of CBG, and 12.5 of CBGA. Again, taking one of those at lunchtime. And then at dinner time, folding in one of the full spectrum hemp soft gels. So that's 25 milligrams of CBD with 1 milligram of THC, taking one of those. So why does this work? It provides the steady cannabinoid support throughout the day with low dose THC in the evening for calm and rest. And so this would just be like the baseline to get them started. And then we would add in support if needed. So example, if they had difficulty with sleeping, this is where we would add in the sleep gummy. The sleep gummy has 25 milligrams of CBD with L-theanine, passion flower, and melatonin, no THC, again, keeping the THC low. And they would be using that 30 to 60 minutes before bed, adding in support if needed. Now, if the patient had no energy or low energy or they're not engaging, this is where we would fold in PRN energy gummies. So one of the things that you could do is you could replace the broad spectrum soft gel in the morning, or you could stack it as a PRN if needed. So adding in an energy gummy after breakfast or between breakfast and lunch to give them some more energy in the daytime. It's got B vitamins, so B9, B12, low dose caffeine equivalent to 20 milligrams of caffeine, which is considered to be a quarter cup of coffee. You know, some of residents, you know, some of the other people that have been using this in their assisted living facilities have said it's made a huge difference. So again, this would be people that aren't sensitive to caffeine. You know, because sometimes it could make them a little bit too elevated. So it would just be depending upon the patient.
I have seniors that are taking this every morning, the energy gummy.
Energy gummy, and they're doing really well. Yeah. Yep. And then again, you know, looking at some more, you know, for more of agitation, anxiety, and pain. So this is where we fold in the T65 gummy. So starting with a quarter of a gummy might be dosed at breakfast, lunch, dinner, and bedtime as needed. Can increase to a half a gummy if needed every 6 hours. So this would be how to use folding in a little bit more THC, but having CBD be the baseline.
Well, and this gummy in particular is everything a senior needs. And with dementia, with Parkinson's, with MS, with, you know, cancer and pain, etc. It's 50 milligrams CBD, 5 CBG, 5 CBN, and 5 THC, all in one gummy. That's why we call it the T65. And what Nurse Sherry's been doing with some patients with dementia is cutting them into quarters and giving one at breakfast, lunch, dinner, and bedtime. So they get one gummy
a day,
but in 4 doses. And that's, you know, 1.25 milligrams of THC each dose. And it's easy to cut into 4s, you know, and so that's a great way to go. And it'll pair with extra CBD or, you know, other things. And it's also lower doses so that, you know, it's going to have less interactions with the pharmaceuticals as well. But it's really the best bang for the buck out there on the market. I've studied all the other CBD companies, and this I think is the best.
Yep. And so then it just goes into, you know, PRN as needed dosing guide, what to watch for, when to hold, and simple rules for, you know, staff if they're going to be administering this in a facility.
Mm-hmm. Yep. All right, cool. And so, yeah, we put that in the chat. I just put in okay, no worries, Cam. So yeah, this cannabinoid care, you can open that and save it in your computer and share it with facilities, with other staff, and of course with patients. So I always like to wrap up with this. You know, I have a dream, and here's the future. Nurses are the game changers for dispensaries to add the clinical care and wellness focus for patients. Dispensaries are going to need those one-on-one and small group coaching and education, and they're also shifting back to high quality tested medicinal formulations. Now is the time. with Schedule 3 for sure. Healthcare is going to be looking for data sharing for outcomes, pharmaceutical reductions, cost savings over traditional care, and then disease management in health plans, case managers. Cannabis nurses can connect with the MSOs of the future and health plans to manage high-cost member care. And the MSOs, meaning that we can have a national stage. You know, one of the limitations with this field earlier was it was so local, right? Think about just a dispensary in my neighborhood, right? Now we're going to be able to have MSOs eventually where you'll have the same product available in all 50 states in a dispensary.
Well,
and then things are different.
Some people may not know what MSO is.
Yeah, a multi-state operator.
There you go.
And then, of course, good national hemp CBD companies like Bloom Hemp is already nationwide. So, and those were the ones that are going to hopefully be folded into ACOs and managing the members' care. And insurance companies will eventually have reimbursement, HSA dollars being able to be spent, cashless payments, digital ordering and tracking. Our friends over at Cannalinks are trying to build something where you can do that. You can get your doctor recommendation, upload it in the system, and then get discounts using your HSA card at dispensaries and having a monthly allowance from a insurance company and the employer in that case. And then, of course, in medical and nursing schools, the endocannabinoid system will be taught as a first-line therapy. So that's my dream. And then, of course, I always close with, if you can master the ability to be effective without complete information in complex environments and volatile situations, that to me is a person, a team, and a culture and an organization I always bet on. And we want you to always bet on us. And we'll just continue doing all the right things to help you soar high as a CNHC. So that's it for the recording. Let me just stop sharing and pause that. So let me pause. So let me say goodbye. All right. So yeah. So goodbye, everybody. Happy May, happy Nurses Month, and God bless you. Let us know anything we can do for you. All right.
Remember, it's all about living your best life and helping others do the same.
There you go.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.